Morning, everyone. We're just going to give it a few more minutes for others to join and then we'll get started shortly.
Good morning.
Hi, good morning. We're just giving it just another few seconds or so for folks to join. In the meantime, I will get the presentation back up. Okay, I think we can go ahead and just get started. And just FYI, since I'm screen sharing, I can only see a couple people at a time on the screen. And so um, as we're going through the meeting, if y'all have questions or things to say, I'll need y'all to speak out loud because I won't be able to see head nods and such. But good morning, everyone, and thanks for being here today. It's been a little while, so it's good to see your faces. And I appreciate you all bearing with us early in the morning on a Tuesday. Um, we have a pretty packed agenda today, so I'll just go ahead and jump in. We'll start with some updates from our office and some of our partners within our department. And then I'd like to talk through and share some updates with you all about the strategic plan and our planning for implementation. And then we want to spend the bulk of this meeting talking about the county profile document that I shared with you all yesterday and that our epidemiologist Kenla has been working really hard to put together. And so we want to get some feedback for you all to refine that document so she can move forward with finalizing it. And then we'll give a chance for folks to share any updates that you all have that you'd like to share with the group, and then we'll wrap up. So it'll be a packed but quick morning. So starting with updates, just some staffing updates, and also I took the opportunity to throw in some of the pictures we got from the conference. So you'll see some pictures throughout this presentation, but we've had a few updates since the conference where some of y'all were able to come to that meeting, and then for others, there's been even more updates since the last time we've seen you. So first update for those who were not able to come to the conference and meet our two new program coordinators. We did onboard those folks back in November. And so, and if you remember, those are the program coordinators that we were able to hire through our CVIPI grant, and they'll be focusing on our training and technical assistance from our office for community violence prevention and intervention. And so those are Desiree Lakey. Desiree, you can just wave in case people can see you. And then Arthur Durham, who I believe is on the call as well. Desiree joins our team from the Lone Star State, I think is what it's called, from Texas. And her background has been most recently in working in the anti-trafficking space. And then Arthur Durham joins us from Greensboro from their previous Office of Community Safety, which is now the Department of Community Safety. And his background is in community violence intervention. So really happy to have them on board. And then another update since the conference and really recent is that I have been appointed to director. Um, that I'm excited to be able to continue on with the office. And with that, we will also be able to rehire for our deputy director position. And so looking forward to that. And with that position, we'll be reshaping it a little bit since now I sort of meet the needs originally identified for that position. And so we'll be thinking through the current needs of the team and working on beginning recruitment for that over the next few months. And so we'll keep y'all posted and share information once that posting goes out to share with your networks and anyone you think might be interested. And so those are all of our staffing updates right now. So I'll pause there and see if there are any questions before we move forward. And again, I'll need y'all to say the questions out loud because I can't see. Okay.
This is
Hearing,
Suzanne. I don't have a question, but I just want to say congratulations. And I'm sure I'm saying it on behalf of everybody. We're super, super, super excited for you, and it is so well deserved.
thank you so much. I really appreciate that.
Ditto. I have to say that I'm thrilled, Ciara, excited for you and glad that you have a couple of other people on the team. And as I dropped in the chat, thrilled, of course, to have Kenla as part of IVP as well. We share her, so we're thrilled. Thank you.
Thank you. Okay. I thought I heard one more voice, but maybe not.
That was me, Sheriff Burkhead, just echoing what everyone has already said. So big congratulations. Looking forward to continuing this work with you.
Thank you so much, Sheriff Burkhead. All right, so next on the agenda, we want to share some updates with you related to our office and sort of like next steps. I know that has been a big question with our executive order end date getting closer. And so I'm going to pass it to our new Chief Deputy Secretary, Caroline Vallon, to share some updates with you all about plans, well, some transitions that have happened at our department, and then what that means for OVP and kind of next steps. So Caroline, I'll pass it to you.
Hey, good morning. I hope everybody can hear me okay. It's good to see some of your faces. Welcome 2025. It's kind of off to a bang so far. As first of all, I do want to offer, my phone is ringing on my computer. Let me cancel it. First of all, I do want to congratulate Ciara and reiterate that in 2024, Ciara came in as our deputy director, and we were so excited to get her in that role. And 2 weeks in, she found out that the then director was leaving, and she had just, kind of just dove in. And I am so grateful. The election years are tough. There was a lot of possible transition. And I mean, she dove in, she got the grant award that has allowed us to increase our staffing, work with you guys to put together a strategic plan, and it is now working on the implementation efforts for that. She really did all the heavy lifting on the convening we had. And so there was no doubt in the secretary's mind and the governor's mind that we wanted to thank Ciara. And we had to wait till we got through into a new administration and for everything to shake out. And we just are thrilled that she is willing to join as director. And this is a personal thank you, as for her have stepped in a period of transition and to help us stabilize everything. I very, very much appreciate it. And as I've alluded to, there have been transitions happening everywhere in state government. We have a new gubernatorial administration. Obviously, there are some staffing changes at DPS and other departments. San Hoekstra has moved into the chief of staff role. I've moved into the chief deputy secretary role. And then we are, trying to negotiate the department kind of adapting again. We are working on an MOA with the Department of, with the State Highway Patrol and the State Capitol Police, because effective July 1st, they will be their own department. So we're navigating all that. And so we've just been a little bit in transition. But that has not mean there's been any wavering commitment to violence prevention work. I have talked with the governor's office. He remains committed to violence prevention work. As you know, he was one of the first co-chairs of the Task Force for Racial Equity and Criminal Justice, which had put forth a resolution to support the creation of the Office of Violence Prevention. So I just wanted to, I guess, if there were any concerns, allay those concerns as much as possible, that the secretary remains committed to violence prevention, the governor remains committed to violence prevention, and so the Office of Violence Prevention continues. The only thing that is a variable is, I don't know if the governor's office is going to do another executive order. That does not mean we have to have an executive order continue our work. The secretary certainly has the authority, and it is within his purview to organize the Department of Public Safety as he sees fit. And so Office of Violence Prevention will continue. We also believe that the advisory board is just critical for us to have subject matter experts from around the state, all working in different fields, be it public health, be it public safety, be it directly in the community violence and violence prevention space. We need your input. So we will be continuing to work with an advisory board. The governor's office absolutely agreed that that was the smart thing to do. So that is going to be, we want the advisory board to continue. We think you guys have been invaluable. And I think that the next step is Ciara will kind of be talking to you and working with you individually to see if you want to continue to serve. Some of you have been very active, and I so appreciate your commitment to this effort. I hope those of you that have been involved want to continue this work. But there have been some others that have not been as active, and so we're going to check in and see if they want to continue to serve. We will be contemplating new members that the secretary will be able to appoint when we get to that point. So if you've got recommendations, please send those to Ciara. Those will be vetted and as we kind of decide what this body looks like. If you think we have a void of some kind where we don't have adequate representation, maybe you think we need more folks in a specific subject matter expertise that could really benefit the advisory board, please send that information to myself, send it to Ciara. And whether it's academics, whether it's direct service work, whether it's, I can't imagine you'd want more state government representation, but however you think we could improve and beef up this group and what they do, we're all ears while we contemplate this. And because I know that now that we have a plan and we have some staff and they are beginning to engage with their local communities, we want to make sure that we are implementing and being true to the commitment that you guys put forward when you develop the strategic plan. So I hope everybody will contemplate continuing their work. I certainly know that some people have moved into new roles. I understand how busy you are. So if you aren't able to continue, just let us know and please pass along a recommendation for somebody who might be able to continue in your place. I think that was a lot, but I just wanted to reiterate the secretary and the governor's commitment to this violence prevention work, and us continuing at the Office of Violence Prevention to investing in this space. And we're going to be reaching out to the General Assembly, try to do some education of the things we've already accomplished, so we can really showcase some of the things that we are doing. Any questions? Okay, like Ciara said earlier, I can't see everybody, because we're sharing the screen. So if there are questions, please just speak up or raise your hand. I think I'll see you then. Okay, Ciara, I'll turn it back to you.
Thanks so much, Caroline. As Caroline said, our office isn't going anywhere. We'll be continuing to move forward, and we'll talk a little bit more later about the implementation of our strategic plan, which is what our team is really focused on right now. So next, I'm actually going to switch around, and because Caroline covered a lot of what I was going to say about the advisory board, but also I know that Caroline Farmer will have to jump. So Farmer, I'll go ahead and pass it to you to give an update regarding funding and the landscape that we're currently in.
Yes, thank you. I hope can everybody hear me all right?
Yes.
Okay, good. All right. So yes, I'm going to be running into a meeting at 9. So I appreciate you moving things around for me. As far as funding goes, this Friday night, we will have opened the CVIPI, the Community Violence Intervention and Prevention grant applications for people around the state. We will also at the same time be opening up the SCIP, which is the State Crisis Intervention program. So people will have 2 months to get those applications in, and then we will have our SCIP advisory score them. And June 5th, the commission will vote. So we will know more pretty quickly. I wanted to make sure y'all knew the CVIPI is going to be focused a little bit more on the rural, some aspect of touching and supporting our rural communities. The SCIP advisory, the SCIP grants are going to be a little bit more behavioral crisis intervention sort of focused in terms of their priorities. Both of them have a hospital-based violence intervention as part of the plan. Both of them have a CVI component, a behavioral component. It's just that the ones, just because of the types of the grants and how they were written, the CVIPI has a rural element, SCIP has a crisis intervention element. So just so be clear, we will send out notices to people who are signed up for our newsletter about the opening of these grant awards. But if you want to go ahead and let people know that by Saturday, everything will be out and open, it is because it starts March 1st, and that is Saturday. And then just a quick update, we are doing a March 17th community meeting in Henderson, Vance County, to talk about the violence in that community. As y'all may know, we had a meeting in Robeson last year, and those meetings continue in that community. And they're currently doing a SIMS mapping in that community to get a full list of the assets. As far as federally and where we stand, Governor's Crime Commission, just like Caroline Valland and Ciara mentioned, that we are all supportive of community violence intervention moving forward. The commissioners have supported this as a priority area. Federal funding is unclear at this point. We have not had any restrictions or changes to our funding. No modifications and no notice of anything. That being said, we don't know if something will change. So we are trying to make sure that we are getting everything up and running and moving forward, until we know something otherwise. But we will work with whoever our subrecipients are to help them meet whatever the requirements are if there are any changes. So, and our legal counsel is fully aware of all the for existing grants on where we stand. Any questions for me? All right. Thanks, y'all.
I'm sorry. A quick question, Caroline, before you
Sure.
get it. The SKIP grant, did you say, are those for municipalities or are those for community-based organizations and nonprofits? Who's the?
There has to be a certain level of local government as part of that grant. So both are, and we have some designation as to whether you're a nonprofit, whether you're a local government in there. And so as part of the voting, we'll have to meet our federal requirements for that.
Okay.
Yeah.
Any other questions for Caroline before she hops? Okay. Well, thank you so much, Caroline.
Thank you.
We'll also be sharing out once the RFA is released. We'll share that out with you all directly. Okay. So let me get the presentation back up on the screen. So Caroline talked a lot about the advisory board on next steps. And so just to kind of recap and add a little bit more context, as she mentioned, we will continue with an advisory board, and we've gotten that okay from our leadership and the governor's office. And so at the conference, I communicated with you all that the current term for this board will end with the end of the executive order. And so, as Caroline mentioned, we'll just be doing a little bit of restructuring of the board over the next few months. And then we're hoping to begin a new term at some point in the summer, maybe mid to late summer. But if you all are interested in continuing, like she said, please reach out to me. I know some folks have already, reached out and given some context about where you stand in your capacity to continue on to this board. And so please continue to reach out to me. And then also, like she said, if you have recommendations for other folks for us to consider for the board, sectors or gaps that you feel like we have, definitely open to that feedback as we think through this new structure for the board and try to look for some additional folks to add perspective to this group. And also, one other thing related to the advisory board is during the conference, we did a reception at the governor's mansion where we took a moment to recognize our advisory board. This was a picture from that. But I bring that up because we also handed out certificates of appreciation to board members. And for those who were not able to make it to the conference, I do want to make sure that you still get your certificate. And so I'll be reaching out to y'all one-on-one to just determine best mailing address, or if there are going to be opportunities that we'll see each other in person so that I can make sure we get those distributed. So just look out for some communication from me about that. Before I go into resources, any other questions related to the next steps for the advisory board? Okay. Well, just really quickly with resources, I wanted to let you all know that our videos from the conference are officially available on our DPS YouTube page. And so I'm going to ask Desiree to drop the link in the chat. That'll take you directly to the page to find those. And so you can, well, hopefully that'll be a resource to you all, but then you can feel free to share that with others. Okay, there we go. So yeah, so those videos are available. And then I also wanted to make y'all aware of another resource that we have. Last fall, we partnered with RTI, the Injury and Violence Prevention Branch, the Injury Prevention Research Center, and then the North Carolina Public Health Association to develop a video, an educational video about CVI and the current landscape in our state. And so this video is now available. It lives on RTI's YouTube page. And we'll get that link in the chat for you all as well. But this video would be a great resource to educate those who are unfamiliar with what CVI is or unaware of some of the CVI work happening within our state. So more of an educational video for those new to the topic rather than for those of us on the call who have a bit more experience in the space. But wanted to make you all aware of this, and we also have this posted on our website to access as well, but that QR code will take you to the video. Okay. Any questions about this or any final questions related to our updates before we move forward in the agenda? Okay. Well, hearing none, we'll move forward. So like I said, I want us to kind of check in about the strategic plan. I know the last time we spoke, that was really around the time that it was first released. And so since that release, we have received a lot of good feedback about the plan. And our office has actually been contacted by several local groups looking to either create something similar for their communities or even interested in utilizing this plan to guide their group's work. So that's been really exciting. That people are finding this as a valuable resource. And also, I know that some of you all have been approached by media and others to kind of speak about the plan. And some of y'all have reached out and kind of passed that along our way. And so at this point, probably don't expect to get too much more media interest about it. But if you do, please know that you can pass that along to us, and we're happy to kind of field those requests on our end or support you all in being able to respond to those requests if you're interested. But over the past couple of months, our team has really been spending time thinking through the next steps for this and how we move forward with actually doing what we said we wanted to do in this plan. And so we've been doing a lot of planning over these past few months and are currently working through trying to finalize those plans for long term for the life of this plan, but then also immediate plans for this next calendar year. And so we've been working on building out a calendar of events and activities. And so we hope to finalize those like longer term implementation plans soon. But let's just kind of recap our goals. And then I wanted to kind of share some updates on what we, as of right now, know that we have planned for the next few months. So with this first goal of enhancing collaboration and coordination, if you remember, this goal was really focused on working to break down silos across our state and truly build a ecosystem that helps us all better align efforts and maximize resources. So that was the focus of this first goal. The second goal of strengthening the workforce was really focused on trying to ensure that there's consistency in skill sets and shared language across the sectors and the roles, all working towards this shared goal of creating safer communities in our state. And then also that the folks doing this work have access to the needed tools, resources, and support to efficiently and effectively do their part in moving this ecosystem forward. And then the third goal to prepare and empower communities was really focus on ensuring that communities have the infrastructure and information needed to act on and move forward effective strategies. And so, like I said, we've been doing a lot of thinking and planning. And so for this first year, we have, or I guess this next calendar year, I'll say, since our time frame started in 2024, for this next calendar year, we've got a few things on the horizon that we're planning in alignment with moving forward on making progress towards the goals we laid out in that plan. One thing, or the first thing on this list, is we will be starting a newsletter. And so we're hoping to roll that out within the next month or so. And the intention with that newsletter is to really help us just keep growing and keep this growing ecosystem connected and to be able to share resources, information, and raise awareness about impactful work happening across the state. And so we also will be working to put together some webinars that will allow us to just provide education at a larger scale. And we are planning to host our first webinar in April. And that webinar is going to focus on the public health approach and really just educating on what it is and how you apply it to violence prevention. And we intend that to be the first of several webinars that we'll host throughout the year, but that is the first one that we have planned in April. And once we have the flyer and specific date for that, we'll make sure we get that information to you all. We are also working to sort of restructure our website a little bit and creating a specific or dedicated resource page that will just make our current and future resources from our office and key partners more accessible. And that's sort of a first step towards a longer goal. Sorry, something popped up on the screen. Anyways, that's the first step to our longer goal of just continuing to try and make resources more accessible at the state level. And then related to that resource page, we are working on putting together a few resources, and the first one that we're prioritizing is the county profiles, which we'll talk about in a bit more detail later on in the meeting. Then we also do intend to host another statewide conference, and we are going to begin planning that soon to give us much more lead time on that than we had last year. And so we're going to be aiming for a fall date again. It seemed like that was a good time for the majority of folks who provided feedback in our post-evaluation survey. And so we're hoping to be able to start planning soon and get a save the date out in early spring. And we'll be doing a planning committee again for that. And so for those who were a part of that last year, we'll be reaching out to see if you're interested in helping out again. But for those who may not have been a part of that, but may have interest in being a part of the planning committee, feel free to reach out to me about that. And then in addition to the conference, we also plan to host regional meetings with a similar intention to just provide that similar collaborative environment for networking and learning, but at a much smaller scale. And that's something we'll also be putting together a smaller planning committee for, because we do want to put together and host those regional meetings in collaboration with a local partner. And so those are two events that we have on the horizon for this year. And we're thinking that those regional meetings will happen in the summertime. Almost done with this list. Lots of things going on, lots of moving pieces. But we are also planning to host a variety of training workshops over the life of implementing this plan. But for right now, we're focusing on putting together a workshop focused on bringing data to action. So really trying to help city or county groups work through those first two steps, essentially, of the public health approach to define their problem and really better understand the risk factors, exacerbating that, and the protective factors available to support that, so that they can be prepared for following through on identifying the appropriate strategies and then implementing those. And so we're working on putting that workshop together with a couple of subject matter experts in the systems thinking space. And for this initial workshop that we'll host, we really are focusing that on, or trying to prioritize groups, one, that are sort of more at the beginning of their process, and so looking to really just get started on figuring out some violence prevention efforts for their community. And also, if possible, we'd love to be able to prioritize our rural cities or counties. And then something else that we have planned on the horizon is to develop and coordinate a data work group that will bring together the sort of data people or the folks on that are part of different local programs that are their evaluators or maybe not formally evaluators, but are doing that function for their team, just so we can give them an opportunity to, connect with their peers, learn from each other, share information, and also potentially find opportunities for collaboration. So we're looking to start that up over the next couple of months, and we'll share some information about that in the newsletter about kind of first steps to get that started and how to be a part of it. And then lastly, we will be focusing on doing a lot more hands-on TA, and that will be ongoing over the year and then the life of this strategic plan. But for right now, or more immediately, we're partnering with GCC to do this in Vance County. So that event that Caroline Farmer mentioned, we're partnering with them to kind of help a group in Vance County initiate, next steps for planning some type of violence prevention interventions or interventions for their community. So that was a mouthful, but that's just a snapshot of what we have planned for this year. And of course, for one, we'll be keeping y'all all updated along the process, but then also we'll be asking for your participation and support as we try to move these things forward. But I'm going to pause there to see if there are any questions, thoughts, anything.
This is Becky, and I was curious if, with the hands-on technical assistance, if you'll be working with any existing CVI groups or hospital-based groups, or if it's primarily for new groups.
No, it's not just for new groups. That would be for anybody. But it would be based on them reaching out to us and expressing that need for the existing groups.
Thank you.
Yeah. Great question. Any other questions or thoughts?
Ciara, this is Sheriff Burkhead. I'm very interested in all of the initiatives and goals that you've laid out, particularly the county profiles. Will that focus on gathering incident data and demographics? Can you speak just a bit more about the county profiles?
Well, I'm gonna pause on answering that right now because next we're gonna talk about that, and Kenla will go through all of that in a lot of detail and hopefully answer that question.
Perfect.
Yeah, I'm glad you're interested in them. Any other questions before we do move forward to the county profiles? Okay. Hearing none, let's go ahead and jump in. So Kenla, I'm going to pass it to you and I will be your hands. So just let me know when to go to the next slide.
That's great. Thanks, Ciara. And thank you, Sheriff Burkhead, for creating a perfect segue into our next section here. So yeah, you can advance the next slide. So yeah, good morning, everyone. So we're going to take some time now to provide a little bit of context on one of our first data products that we'll be rolling out on the county violence profiles. And then I'll also give an opportunity for the advisory group to advise. And so I have a lot of questions for you and I want your feedback. But just as kind of like a background, so the purpose and kind of goal behind creating these county violence profiles was to integrate violence data from multiple sources into one easy access, interpretable, and useful format. So we have a variety of data sources of amazing, surveillance data sources with like health data, criminal justice data, emergency department visit data. We have a lot of different sources, but they're in different locations, sometimes in different formats, and sometimes require a certain level of data literacy to interpret. So the idea is kind of putting it all in one place with the intended audience of local violence prevention program leaders and staff, policymakers, advocates, people that could benefit from just kind of like a quick snapshot of violence in their county, and with the intended purpose to better inform planning and direction of violence prevention activities and resources throughout the state, but also at the local level, at the county level. So a little bit of like summary. So we've kind of like gone through multiple iterations of just like trying to think through, okay, what would be most helpful in what format. We're really trying to like make this the like application of and like interpretation of data as easy as possible for people to really use this as like an action, like data to action product. So yeah, without further ado, I think a couple of just like important notes. So we're just going to take this time. I really want your feedback. I know we have people from a variety of different sectors. We want your feedback based on how you think this could be used, the applicability of it, and so that we can make these final edits going forward, and then we can start producing these for use. So are there any questions, just generally speaking, on this slide before we get into kind of providing feedback on the document itself?
Sheriff Burkhead, once the data is collected and compiled, how do we plan to distribute it to those that are doing work in this space? And will this be just for existing organizations that are already up and running, or will this be shared with those who are sort of working on the fringes?
Yeah, so this, I think like our intended audience, like we said, is just like violence prevention program leadership and staff, and their partners, people, you know, in the county and local level. Our intention is that they, you know, we're providing this resource for them, and then they can kind of like share with partners and people as they feel like it is helpful. It wouldn't, our intention isn't that this audience isn't for like the actual participants of their programs. This wouldn't be a resource necessarily for them. It's more for like the staff and program leadership level to better inform their activities. And in terms of like a dissemination plan, we're thinking through that as we go. But the idea is that we want it to be like widely accessible to people, so that they can really use it as a resource. It will be housed on our website, but we really want it to be like accessible to a wide audience. So yeah, I don't know if you have anything that you wanted to add.
Yeah, no, I think you pretty much covered it. So we'll have it available on our website, but then we will try to do some intentional distribution of it. And like she said, we kind of haven't gotten to that step yet of thinking about the dissemination plan, but we know we do want to kind of get it out to some key folks, but then really lean on people to share it with partners and other people within their networks as appropriate. But then, yeah, like Kenla said, this is more so for the people doing work. So whether that be sheriff's offices, local programs, health departments, but people who are planning interventions and programs rather than the people that they support. So does that answer your question, Sheriff Burkhead?
It does. It does. One of the things we run into, we gather all this data and it's very useful, but it doesn't get to the folks who make decisions and allocate funding. And I want to make sure that whether it's through my office or through Crystal's office here in Durham, Crystal Harris, how do we share this information to where we can make our case for additional funding or additional resources, bodies to help do this work, and really stand up a more robust effort for violence prevention. So that's where my head is.
Yeah, and that makes a lot of sense. And that is kind of one intention of creating this, is so that it can be a resource to you all as you are trying to have those conversations and advocate, for funding and resources for your cities and counties. But then we're happy to, one, kind of take suggestions related to our plans for dissemination, but also to be a support to you all in trying to utilize this resource and have those conversations if at all helpful. So feel free to kind of reach out to us about that kind of one-on-one for your different counties and communities. And thanks for bringing that up.
Yeah, perfect. No, thank you.
So now at this point, I want to invite everyone. So we sent out an email yesterday. And so just for if folks had a chance to, with a draft of this county violence profile. So if you can go back into that email and open up that attachment so that you have your draft there. I have a couple of slides, but it will be much easier if you can see it and kind of zoom in on your own. So going to take a couple minutes. I know this is interactive, but we really need your feedback here. So if you've had a chance to look at it, that's great. And so we're going to be transitioning into the feedback part here. Yeah, Sarah, you can go to the next slide. Perfect. So yeah, just a couple of important notes before. So this is the draft that we've created of a county violence profile. This is an example from Wayne County, but obviously the idea is that we would produce this for all 100 counties in North Carolina. So just as a general, so this format is just like a general format with colorblind safe colors. For the purpose of this meeting, we don't want to focus so much on the formatting. But if you do have any burning comments or feedback on the formatting, feel free to put in the chat or email us. But the focus of this meeting, we really want to focus on the content because that's most important. And then we can get some advising from DPS Communications to make sure that the formatting is all accessible and appropriate for our intended audience. The second important note is obviously, as you all know, so North Carolina is very large and diverse, and counties vary in size and population and demographic. And so for some counties with limited data or smaller counts, they might have an adjusted, abbreviated version of this county profile, just so that we can maintain data integrity and because of low reporting numbers, for example. So that's just an important caveat that not all counties may look identical, obviously, because they're different. So anyway, that being said, now I'd like to invite you all. So yeah, because screen sharing, so you're welcome to speak up. I'm going to ask a few questions, but also feel free to put some things in the chat. I'll try and monitor it and kind of elevate things if I want more discussion. But Desiree will also kind of be monitoring the chat and taking notes.
So, Sierra,
So-
this is Liz from Charlotte, North Carolina. Here's my question, as I've been working on with county profiles through the health department, through Kathy Dale at the state, and she's working on a clear impact scorecard for every county. That is part of the community health assessment, the CHA, and part of NCIOM 2030. Is this integrated into that system so we can go to one place and kind of see it all?
No, this is not integrated into that. That's not something that our office is involved in. But if you want to connect us to Kathy Dale, we're happy to, kind of connect and kind of figure out what we're both working towards and if there is opportunity to collaborate or integrate these things together.
Yeah, I think she's got some data that might also help to fill out some of your data too. So that'd be great. Okay, done.
Thank you.
Ciara, is it okay if I interrupt here? This is Scott Preschel-Bow, Division of Public Health.
Yeah.
Kathy's office, we are working with them around the community health assessment, and we've tried to add, an addendum to their community guidance that they're putting out for the health assessment. So it's not completely separate. We are trying to integrate, and we are working with Kathy to a certain extent. But, obviously the community health integration and impact is a much larger project. This one's a little bit more focused, but we're trying to incorporate violence prevention messaging and work in that community assessment that the counties do.
Thank you, Scott. Are you familiar with the scorecard?
Yep.
Okay, I'm wondering if that might be something to work together on. I don't know. I'm not, I'm not sure, but just a thought.
This is Martin Avery, one of the trauma surgeons at Atrium Health Baptist Hospital. Sorry, I had the flu just a little bit up. My one suggestion or comment on this profile is the injury patterns that we see. We see rural and urban, and having kind of a delineation of is there a rural component? Like the injury patterns we see mostly from the rural, mostly suicides, mostly unintentional, as opposed to urban, we see a lot more intentional violence. Seeing how the counties shift in their patterns of violence and where they're occurring throughout the county would be helpful for some of the hospitals.
Yeah, that's great feedback. Yes, so yeah, that is definitely something that we can consider adding in as like a demographic breakdown. I think a lot of this is trying to figure out on like the county level, like we want to try and create this template. But then obviously that would vary by county. Some counties are predominantly rural, some counties really do have that breakdown where you can see, the difference in injury based on rural urban breakdown. But cool. So on this slide, we're going to go into each section specifically. But first, I just want overall feedback. So you're welcome to put in the chat if you just have like, kind of overall thoughts or speak up. So overall, just kind of like general impressions. What are your general impressions on this fact sheet? Is it understandable for the intended audience? Is it something that is visually appealing that you think you would use? What are some overall impressions?
This is Hannah Ledgerton from Buncombe County. Jumping in for Will Baxter today. I really appreciate what y'all are doing and how to put together. Yep.
For some reason, we're getting an echo. Maybe can everybody try to mute? I don't know if that's contributing to it. I'll also mute to try to help. So let's try.
Is it still happening?
Yes. Okay. I'm not sure how to fix it, so just go ahead. We can hear you. It's just an echo, so go ahead.
Okay. Let me know if it's too bad. I'll try to write it down in the chat. I was gonna second what some of the other folks raised about. I feel like this is an awesome starting point. And if in the future, like the next phase, to build on some of the public health scorecard approach of like the story behind the curve of what's happening on the level already, skin protective factors and additional needs or goals. Would be like maybe a second or third set of pages. But for right now, I think it's a really great start. I wish that the violent death rate by demographic section could have some of those demographics merged. So gender plus race plus age. But I also recognize there's trying to make it easily accessible for that balance. Did that come through?
Yes. I think I'm just like taking a little second to try and process with the echo, but yeah, I think it and that was another thing that we were kind of like going back and forth. And my next question is like to try and we want to make this easily accessible and kind of like a snapshot. Obviously, like I mentioned, we have all of these data resources and further breakdowns if people do desire that. And so, like you mentioned, like a breakdown of like the intersection of demographic identities, for example. So like Black male or, female 19 to 24-year-olds, we can do those further breakdowns, but in just like a general snapshot that we want to be easily accessible and interpretable, we wanted to make it really basic. So with that question, we also wanted to just get kind of general, so you can just put a quick answer, yes or no, or in the chat. For a lot of fact sheets, the thing is one pager. We want a one pager, so it's like easily accessible. But one pager can often mean one side single sided or 2 pages front and back. In your sectors, in products that you've used and love, is there a huge difference? Do you really prefer just the one page single side, or do you think it would, having a one page front and back would be equally as accessible, and then just provide a little bit more information, or just maybe just like be easier to read? Is there any overall preferences, or does it not matter? And feel free to just dump in the chat if you have a preference, say 1 page or 2 page. Trying to monitor the chat here. Charlotte had a great question. I think, so she asked, do you anticipate the profiles will be consumed primarily via web or printed page? And that, again, we need to think through the dissemination plan, but I think what we're thinking of is primarily online, because that's how we'll have it accessible via our website, so an online PDF form. But we, again, like we mentioned, we anticipate and we want it to be shared more broadly. So how partners and local counties want to use that, they may decide to print and disseminate. Okay, I'm seeing a lot of great feedback in the chat, and I'm going to leave it up to Desiree to try and monitor and organize this feedback. This is great. We're going to move on. So I just have a little breakdown section by section, and I see some of these comments are great. So maybe if you could elevate some of them as they correspond to specific sections. So this first section is just like our county overview section. So I just want to provide a little bit of context, especially if people are comparing profiles, like, between 2 similar size population counties. So in this just general small section, what are overall thoughts? Is this information interpretable and helpful? Or is there any unnecessary jargon?
I think this is really good, just foundational information on the county to kind of paint the picture.
I think, yeah, I mean, this is a pretty simple section. I did have a question for those kind of more involved in the with the trauma centers. So we just identified the kind of system that we have right now is we just identified the closest geographic level 1 trauma center because we thought that was an important kind of little tidbit for people to place. Is there a best practice for identifying affiliated trauma centers or ones that we should highlight or identify? Does anyone have?
Yeah, this is David Jacobs from Charlotte. I think this is fine, but I also think that some of these patients can probably be handled at other level trauma centers, the level 2s and level 3s. There's no clinical difference between a level 1 and a 2. And so if you've got a level 2 trauma center that's close to you, so I just wonder whether it might be better just to say the nearest accredited or designated or verified trauma center and just leave it there and leave the level 1 out of it. Others may feel differently. But I think that most of these patients are going to be taken to the nearest trauma center, regardless of level. They may ultimately be transferred to a level 1 center, but they're going to be taken to the nearest trauma center for initial stabilization. And that's probably the more important thing for folks to understand. That's my opinion.
Yes, thank you. Thank you. That's what we were looking for. That's
Yeah, I agree.
'cause
Yeah.
Awesome.
Yeah, I agree.
Awesome. Yeah, that sounds great. And I think that would also simplify things if we just say, you know, the nearest, like you said, accredited trauma center is. And that would be in terms of just geographic designation. I know some trauma centers kind of have different affiliations.
Well, again, yes, you're right. Some are affiliated. Some counties are, depending upon where they're located, they're affiliated with different trauma centers. But I think the goal, and this is probably information that you don't need to know, but we are working on a state trauma plan right now. And I think the goal is to get the patient to the nearest appropriate trauma center as soon as possible, regardless of affiliation. And so again, I think having just listing the nearest trauma center, it may be helpful for me as a trauma surgeon to know how far that is. And so if it's, 20 miles, that's that's very, very different from a trauma center that's 50 miles away. And so for me, just saying the nearest verified trauma center is ECU, 20 miles. That sort of helps me as we think about making sure that folks have ready access to trauma center care.
Yeah, thank you. I think that's helpful. Well, if there's any other feedback on this section, feel free to put in the chat. I see it's very active. And thank you, Katie, for providing some context on where this health data is coming from. We can move on to the next section. So this next section I want to highlight and just kind of dive deeper into this section was the crime section. This data is taken from the National Incident-Based Reporting System, which is managed by the Criminal Justice Analysis Center at GCC. And so this is kind of like reported crime surveillance data. So I wanted to ask the same questions on this section, kind of what our overall interpretability, accessibility. Do you think this information is helpful? Is there any things that you don't understand or how it's presented? Okay, hearing no feedback, but I do. Yeah, sorry. Oh, was someone speaking? I wasn't sure. I do want quick feedback on, we have this little violent crimes per 100,000 people comparison to the state rate. Is this a helpful and useful kind of figure comparison to have? Or do we think it would be more helpful just to have, the state rate presented or the county rate?
Sheriff Burkhead, no, I think this is fine. I think this tells a story, and having the percentage of increase and the total number of crimes and comparing it statewide, I think is is spot on. Looks good.
I 100% agree.
Yeah, this is one section where in a few number of counties, they have limited or they have lower reporting percentage of their neighbors reporting. And so in those counties, we may have to modify slightly just based on reporting numbers, but we'll include that in a data note to say, due to low reporting numbers, we can't report these rates, but hopefully then that incentivizes people to make sure that they're reporting. Cool. We're gonna move on to the next section. And all of these comments that I'm seeing in the chat are really helpful, and we'll think through them too. Okay, so this next section is the violent death section. I think Katie was including a lot of information based on the violent death reporting system, and that is the data that we took for this section. And so that is surveillance data of all violent deaths, and it integrates law enforcement, Office of Chief Medical Examiner, and death certificates into one kind of like data source. And so this is where we have kind of the most demographic data on violent deaths in each county. So again, overall feedback. What do we think of this section? This is also figure and data heavy. Are these figures and interpretable, do we think, to our intended audience?
I think this is good. If people want more, they can click on links, or as Katie is sharing, they can go on the VDRS website and get more. I think, the idea is to just give a snapshot. All we need is a snapshot to get an idea, to be able to have some talking points. And if we need to expand, then people can find the information elsewhere. It's easily accessible. It's not that it's not, and you guys can provide that on the website alongside this, this one pager. Here's links for more information or the breakdown of this information. I don't think a one pager should be too dense.
Yeah, thank you, Azuri. I think that's great feedback. And I did see in the chat, I don't know who put it there, possibly including hyperlinks or, like you said, kind of like on the same page of providing this resource, we also have links to the data dashboards and other fact sheets where they can have a further breakdown.
Becca, I thought I saw your hand raised. Did you have something for this section?
I was trying to thumbs up and clicked the hand. Sorry.
Oh, all right, awesome.
Okay, I do see your question. I think it might have just cut off in this screenshot in the full one pager. So if you can look at your the one that we sent out, it does have a little data note defining violent deaths. Yes, right there. Thank you, CR. I think I just cut it off in that screenshot, but violent deaths includes deaths due to homicide, suicide, and unintentional firearm injury. Awesome. Cool. We can move on to the last section then. So this is our last section just on violent injury. So this data is taken from NC Detect emergency department visits. And so we have this kind of like yearly breakdown and show the increase or decrease annually. Any feedback on this section, interpretability of the figure? Any thoughts there? And it's okay if you have no feedback. That means we've done a great job on this section.
Yeah.
I think if there were a way for local counties to work with you on this, like I'd be curious to see this data like as it is versus as it would be disaggregated by race and ethnicity for us, because some of our biggest needs and areas for growth are around the inequities in our violent injuries.
Yeah, so like we've kind of already talked about, you know, having that further breakdown might be helpful. Do you think in this resource, or do you think just having a link to, you know, a dashboard or something where you could break it down further would be helpful?
I guess that's why if there was a way for each county to I love the template, but if there was something that each county could say this the way this section is showing up doesn't actually represent, or just to be able to review it, and if there was a need to tweak something or add something additional for the county, that maybe that's where the second page could adapt if there's a one page, if there ends up being a one page template that everybody does. If there's a way to make sure that we highlight key points on the local level on the second page.
Yeah, or if we don't do a second page, maybe just including like at the bottom, like we mentioned, you know, for more information or for more demographic breakdown, or with links to those resources. Any other thoughts? I thought I heard someone, but I can't see everyone, so. Great. Sarah, if you can advance to the next slide. I just have some final kind of like, if you have any other thoughts, or I think we talked earlier about how else do you envision this fact sheet being used and with what audience, feel free to put in the chat, or email us later if you have further feedback. And then Sarah, we can go to the next slide. But we just want to provide you kind of some information on these next steps. So we will summarize, take note of all of this great feedback, and integrate that to finalize our template. We'll review formatting with DPS Communications to make sure, like I said, that it's accessible, depending on, you know, the primary format, and that it works with branding and style. And then we're going to create them, produce all 100 of these county profiles, and our anticipation completion of all of these will be late spring. So we'll notify you when they're available on the website, and when we have more thoughts kind of on a dissemination plan of how we want these to be disseminated. But are there any last questions or thoughts related to this product? Thank you so much for all of this great feedback. This is so helpful.
Yeah, thank you so much, Kenla, for facilitating this conversation and for putting this together, putting together that draft and the multiple copies to come for all 100 counties. But I'm glad to see, I see in the chat and through the discussion that it seems overall that people do think that this will be a helpful resource. And so we're really excited to hear that. And we will take this feedback and kind of refine it. And I was trying to type in the chat, but couldn't get it out quick enough, to, I guess, following up, Hannah, from your questions or feedback. I just also wanted to make sure that you all know that if you do ever have a data need that isn't satisfied by this resource or other ones that exist with our partners, you can still always reach out to us about specific things or specific pieces of data that you're looking for, and whatever we are able to help with, we can. Kenla does have access to data on both ends, the criminal justice and the public health side, but then also our partners who do manage those data systems also have processes for putting in data requests, and we can help you all navigate that. So yeah, this isn't the only way you can get information, and we're here to help. Okay, any final questions before we move forward in the agenda? Okay. All right. So next on the agenda is our opportunity for you all to share any general questions that you may have, or to share updates and announcements from your program, so I am just going to open it up for any updates that folks have to share.
Yeah, this is Becky with North Carolinians Against Gun Violence, and I just wanted to invite all of you who are interested to join our North Carolina CVI coalition. It's made up of local, state, and federal partners, all who are interested in working to sustain, expand, and create new CVI programs. We're very active in creating the Office of Violence Prevention, so it's great to be here and to work with all of you. I'll put my email in the chat if you're interested in learning more. Thanks. Oh, and we meet every other Thursday on Zoom.
Becky. Any other updates or announcements from folks?
It's not necessarily an announcement, but more of a question. So now there are a lot of organizations, or should I say on a national level, that are holding webinars about the changing landscape due to the executive orders and how that may impact federal funding, or that people already have or will have. Will there be any webinars from you all, kind of like once more information comes out, or working with some of these partners to kind of help us understand what that changes for programs that are receiving these funds?
Yeah, that's a good question, Azuri. And so I think right now, the update that Caroline Farmer shared is sort of like the updates that we do have right now. But as more information comes out, and when we are, I guess, better able to wrap our heads around, what is going on and what the actual plans are from the federal level, we can look into either maybe a webinar, or maybe just including something in our newsletter that shares a bit of an update and context about that. So yeah, that's definitely something we can kind of keep on our radar. So thanks for bringing that up.
Thanks a lot, Uzuri, for saying that. Ciara from IBP, we don't have anything major. I was just about to say we've been navigating those funding changes as well, and the executive orders, and so nothing major on our end. We're thankful to you all and Kenla to have her as part of our team. So she's done her data updates, but nothing major as far as that. We will be participating in Heal Day with you also, and so we're excited to have IVP representation there. And other than that, we've been navigating APRs, just trying to keep things afloat, and we've been fortunate, of course, that we haven't had to do anything as it relates to staff negatively. So we're grateful for that. So nothing major on our end, but I do want to acknowledge Heal Day because that is a great opportunity. Thanks a lot.
Yeah, thanks for that update, Glorina, and for bringing up Heal Day. And so for more context for everyone, there's a national organization called the Safe States Alliance that is a membership organization for those working in the injury and violence prevention space. But I guess they do come from the public health lens with that. And every year they organize a Heal Day in DC, which basically just provides an opportunity for folks working in this injury and violence prevention space across the country to come and have the opportunity to educate their state representatives about the work that they do. And then Safe States comes in to basically then kind of finish that up with advocating for those representatives to support that work through providing funding in the federal budget and other support that may be needed. And so that's something that happens every year, and we can, in our follow-up email, we can share a link where you all can find more information about that if you're interested in participating. This year, I believe it is scheduled on March 20th. And like Lorena said, there will be some representatives from the Injury and Violence Prevention Branch there. I will be participating, and then some other folks in our state. And if you aren't able to participate, just know that me participating in our office, going there to educate, is really educating about the work that you all are really doing across the state. And so if you'd like to share information with me to include in my spiel as I'm speaking on behalf of our state, please feel free to reach out and do that. But also, if you're able to come and participate, that would be great, because right now it's, more important than ever that people are really aware of what it is actually that all of us are working towards here at the state level.
And Ciara, the other thing I want to let everybody know, we will be taking information, one-pagers. So, and I'm sure, I don't know if you and Kenla will have anything created, but we are going to be doing that. So that's important too for people who are not able to be there. If they, have significant one-pagers. I know Dr. Jacobs, we're part of the trauma advisory team, the advisory council, but I did want to say that that's another way, just in case we don't get to meet the legislators and meet with their staffers, that's information that you can read.
Yes, absolutely. And so along with sharing information with me, if you do have one-pagers or resources, you can feel free to share that with me as well. And I'd be happy to bring that along to share and leave behind with our state representatives. Okay, other updates, announcements from anyone? Well, while y'all might be thinking, one other announcement or update I'd like to share with you all. We've recently become aware that in Durham County, they are officially jump-starting their new Office of Survivor Care. And they are currently recruiting for a program manager to lead that office. And so they've shared that job posting with us. We'll share it out with you all in our update. But that's really exciting news for Durham. And then just really would like to share that opportunity with y'all to share among your networks for those who may be interested. Final call for any other updates, announcements, or questions or anything from the group. Okay. All right, well, hearing none, then we will wrap up just a few minutes early. But thank you all so much, one, for being here today, for your active participation and the really helpful feedback about the county profiles, but also just for your support and participation over your entire term being a part of the advisory board. Like Caroline mentioned, we've really found great value in having this board and having you all as a resource. And so just really forever grateful and indebted to you. And like we mentioned, if you have interest in remaining on the board, please reach out and let me know, or if you have suggestions for those for us to consider. But otherwise, I'll give you some time back in your morning. I hope you all have a good rest of your week,